Well, joining us now, Dr. Mahesh Lakhe with the Internal Medicine and Infectious Diseases at Columbia Asia Hospital in Pune. Thanks very much, sir, for being with us. Let me go up to Dr. Lakhe first. Dr. Lakhe, what in your mind is the big reason that we are seeing at this juncture for this sudden spurt?
Yeah, we have seen that Mumbai has reported almost a doubling of the cases in almost last week. I think, in my opinion, all the local trains have been opened at once. Apart from that, there is laxity on isolation and quarantine in symptomatic patients. Apart from that, people have started, gathering in get-togethers, weddings, different kind of programs. Now, some of the colleges also have opened and classes. So once these people, come out for these kind of crowded places, that definitely is going to, increase the chance of transmission of the disease. Apart from that, it has been seen that, people who have infected with COVID-19 in the earlier phase of this pandemic,
right.
We have seen that, there is a decreasing or decaying antibody print, though there is a T-cell immunity, but there have been some case reports of
so that's
reinfection
important.
in some of them.
Dr. TP Lahane, Director Medical Education and Research in Maharashtra, also with us. Dr. Lahane, are there any indicators or any worries about the potential spread of the UK mutant strain, or increasingly, or for the first time we are seeing reports of the Brazil strain and of the South Africa strain? So is that a real concern going forward?
Good evening. Yeah, in Maharashtra, if you see in the Amravati and in Yavatmal and Akola, we have done the sequencing study of those of the positive cases, and in that, what we have come to know, it is not in Brazil or it is not in England strain, but in that we are seeing the mutation. In four samples were done. Now it is very early to say that is it some strain from where the number is increasing. But yes, there is a mutations are seen in the 8 samples out of 12. We are studying more samples, 100 samples in that area. So we will come to know that what type of mutation is happening, and is this strain from the, you can say, the western, that is England or that. But yes, number is increasing in 3 districts. And other places also number is increasing, but it is not more than 5% in maximum districts. At few places, it is increasing more than 5%.
Dr. Lahane, this is really important what you are saying. You are saying that a number of mutations have been observed in certain parts of Maharashtra. Which areas are these, sir?
These areas, Amravati, Akola and Yavatmal.
And when were these tests conducted to confirm that these were mutations?
Test result came out on the Tuesday. That is 2 days before we have got the result. And the sequencing was done 15 days before, because it takes near about 8 to 10 days for the sequencing. And in that, we have seen there is a change in the sequence of this, you can say, only S gene only. That is a spike protein only, not other places.
All right. So there is a change in the spike component, the spike component of the virus, right?
Yes.
Is this not consistent with the mutations which we've seen, for example, in the United Kingdom?
It is nice. Few, you can say, if the few things are consistent with the United Kingdom, but it is not like an actual United Kingdom. So it is some different mutation what we have seen in the cases at 3 districts. So for that, we'll have to do more this sequencing. After that only we will come to know that what type of sequence is there. Is it with, you can say, England?
Dr. Lahane, is this the first time that you are coming across any mutations in Maharashtra?
Yes, because before that there was one mutation in Akola, that was 25001, and that was also found in Pune. But now this time it is the first time we are finding this mutation. But we'll have to now do more tests, and then this mutation, if it is there, then the infectivity also will have to calculate. If the infectivity is more, then we'll have to take care of the, can say, the patients, and also the surveillance and all other things we'll have to send them.
But Dr. Lahane, would it be fair to say that there is a link at this stage between a larger number of infections with the discovery of this mutant strain? Or is it because people are not doing, wearing masks, going on trains, and it's the old strain which hasn't gone away?
Yes, up till now, what I feel, it is a old strain only, not new. But what is happening, the people are now, they are not going with the mask and anything. Even you see the marriages and the crowd is there and they are not using mask anywhere. So the COVID, we can say the behavior is completely stopped. And also the trains have started in Mumbai. I think this spike may be because of the this thing. It is not because of the new strain.
Right.
And it is very early to say that it is a new strain.
All right. And so just one or two final questions to you, Dr. Lahane, because what you're saying is very important. Firstly, how many samples of mutation have you detected thus far in Amravati?
In Amravati 3, and then in the Yavatmal 3, and in the Akola 2.
So eight samples are inconsistent with the old strain, the dominant strain.
Yes, yes.
And so, doctor, is it not natural, therefore, that some sort of gene sequencing or further gene sequencing is done to compare it with the Brazil variant or the UK variant?
We are doing the gene sequencing to compare, and so the result I think we will get in 10 to 15 days. So that we will come to know the gene sequencing of the previous strain and this new strain, if it is the difference in that.
And you don't know at this juncture if this is necessarily more infectious, right?
No, it is, we don't know, because just now we know the sequencing. Now we'll have to go for the gene study.
Right, thank you both very much for joining us. Dr. Lahane, Director Medical Education and Research in Maharashtra, explaining that a new mutation has been found in the state, but a lot more research needs to be done. We don't want to panic our viewers by any means, but obviously if there's a new threat, we need to identify and scientifically address it.